We only have one frontal bone, and obviously it's located in the front, in the anterior aspect of the cranial cavity. We see here the frontal bone in the anterior view, and we can also see the frontal bone in the lateral view. Now, if we zoom in and we focus in the frontal bone, we can see that the frontal bone makes up the superior part of the right and left bony orbits. And when we look right here, we see a hole. And that hole is in the frontal bone. So that is a surface marking that belongs to the frontal bone. Since that is a hole, that is called a foramen. Now, this is a hole in the superior aspect of the bony orbit. Consequently, this hole was named supra, making a reference to superior, orbital, because the hole is superior to the bony orbit, foramen. And the supraorbital foramen is a bone feature, a surface marking of the frontal bone. Now, I strongly suggest you start learning all bone features associated with the name of the bone. For example, you learned supraorbital foramen of the frontal bone. And then later on in the semester, when you're asked which bone has the supraorbital foramen, that will be an extremely easy question to answer. But now, if we start studying just supraorbital foramen, and right now you know it belongs to the frontal bone, but don't forget we are covering several bone features for several bones. So it might get a little confusing which bone has that specific bone feature when you know so many of them. So make that a habit, and I promise you, your life will be much easier later on. For example, let me just show you a quick example. Here we have an elongated hole, and an elongated hole is a fissure. This elongated hole is called superior orbital fissure of the sphenoid bone. So the sphenoid bone has the superior orbital fissure, and the frontal bone has the supraorbital foramen. I can assure you, if you have a question asking the bone that has a bone feature, and that is a multiple choice question, you will have the names of the bones that are right next to that bone feature. So make your life easy later by learning bone features associated with the name of the bone since now, okay? Thank you. Now, there is one more detail I would like you guys to remember about the frontal bone. This is a sagittal section. So it's like we cut the skull, dividing it into right and left sides, and this is the left side, and we are looking at it from a medial view. This is the frontal bone, and we had defined before that frontal bone is a flat bone, like the parietal bone is a flat bone, the occipital bone is a flat bone. Now, you see right here, inside the frontal bone, this air pocket space. And this is called frontal sinus. And this frontal sinus can get filled up with inflammation when you have a viral infection, a bacterial infection. And when that happens, you have frontal sinusitis. And when you have frontal sinusitis, you feel that pressure in the top part of your eyes, really in the front, because literally this frontal sinus cavity is filled up with inflammation. Now, when you have this air space within a bone, that puts that bone into a pneumatized category. So now you know that the frontal bone, besides being a flat bone, it is also a pneumatized bone. Posterior to the frontal bone, we find the right and left parietal bones. The right and left parietal bones are separated by the sagittal suture. Posterior to the parietal bones, we find the occipital bone. When we look at the occipital bone laterally, we can see it very little, not that much, but we can see it very well in the posterior view, as well as in the inferior and superior views of the skull. So, here we have the occipital bone in the posterior view, and I need you to imagine that we are looking at the skull inferiorly, like it's showing you in this image right there. When we look at the occipital bone from an inferior view, we see this hole right here. And when we look from a superior view, so we removed the top of the skull, and now we are seeing from a superior view inside the cranial cavity, we also see this magnificent hole. This magnificent hole is called Foramen Magnum. And it is very magnificent because passing through it, we have the brain stem, which has the autonomic control centers for our vital organs. So yes, it is magnificent, and it is a hole that allows the brain stem to go through. So this hole is big, and it's found in the occipital bone. How do you learn this? You learn by saying foramen magnum of the occipital bone. Another bone feature found in the occipital bone that you guys need to know are these smooth surfaces I just highlighted there. And you can see them even better in this picture. Guys, these are rounded smooth surfaces. Do you remember how a round smooth surface is called? That is called a condyle. Now, this condyle belongs to the occipital bone. So that is called occipital condyle of the occipital bone. The occipital condyle of the occipital bone sits on top of the first cervical vertebra, which is C1. And the other name for C1 is atlas, because our head will look like a globe, like an atlas, on top of the first cervical vertebra. And if you look right here in this posterior view, you can see that the occipital condyles are right there, and then they will articulate with C1. That would be found right there. Now, look at this picture again, and I would like you to notice that we have an opening right there. And this opening is superior to the occipital condyle of the occipital bone, because this is an inferior view, remember? Now, this opening is, in fact, a canal. And what goes through this canal ends up in our tongue that would be found right there. And the root used to refer to tongue is glossal. And since what goes through this canal ends up underneath our tongue, that canal is named Hypoglossal Canal. So you say Hypoglossal Canal of the occipital bone. And obviously you have the Hypoglossal Canal on the right side and the Hypoglossal Canal on the left side. Now it's time for us to go over the temporal bone. This is the temporal bone. The temporal bone has lots of bone features, and you need to know them all. The temporal bone is an irregular bone. Remember, the frontal bone, parietal bones, occipital bones, they are all flat bones, but the temporal bone is not. It is very irregular, as you can see. Consequently, it falls into the irregular bone category. I would like us to look at this image, because I believe it shows better the bone features we have in the temporal bone. We have this massive bump right here, you see? And a bump is called a process. And since there is a massive bump, is a huge bump, it is the bump that you can feel if you pass your thumb behind your ear right now. That bump is this one. It is massive. Consequently, that was called mastoid process. Anterior to the mastoid process of the temporal bone, we have another process. And this is a very sharp, pointy process. And as such, it was named Styloid Process of the temporal bone. So this is the styloid process of the temporal bone. Now the temporal bone has another process right here. And this process goes towards the cheekbone. And the cheekbone is called Zygomatic Bone. This process of the temporal bone that meets with the zygomatic bone is called Zygomatic Process of the temporal bone, because it's the part of the temporal bone that goes towards the zygomatic bone. Obviously, when we'll be looking at the zygomatic bone, you will find the part of the zygomatic bone that sticks out. It is a process that meets the temporal bone. How do you think this is named? This is named temporal process of the zygomatic bone. Now, I would like you to pay attention to this part right here. And it's better for us to see that in these other pictures. And here we have it. This part right here belongs to the temporal bone. And this is specifically a depression that is found in the temporal bone that articulates with this smooth surface that belongs to the mandible bone. You see this, the lower jaw is the mandible bone. And the mandible bone has a smooth, rounded surface that goes into this part of the temporal bone. And this part of the temporal bone is a depression, and a depression is called a fossa. Consequently, this fossa of the temporal bone that receives this part of the mandible was named mandibular fossa of the temporal bone. And the mandibular fossa articulates with this smooth, rounded surface that we find in the mandible bone. And this smooth, rounded surface of the mandible is named a condyle, because that's how smooth, rounded surfaces are named. Since this condyle belongs to the mandible, that is called mandibular condyle. So the mandibular condyle of the mandible articulates with the mandibular fossa of the temporal bone. This is an articulation between the temporal bone and the mandible bone. This is your temporomandibular joint, which is what you know as TMJ. Let's go back to this image. And here we have the styloid process of the temporal bone that we already identified. And above it, right here, we see an opening. And this opening is in the temporal bone as well. Now, this opening, it takes us inside and we reach the middle ear. This opening is related to hearing. And hearing is also called acoustic, auditory. Now, this opening that is elongated is a canal, and we also call that meatus. This canal, or meatus, that faces the external environment, and it is related to hearing, is named external acoustic meatus, also called external auditory canal. If we follow this canal, we are going inside the cranial cavity, and we will eventually end up in the internal acoustic meatus. So when we look at this superior view of the skull showing us the inside of the cranial cavity, we see right here the internal acoustic meatus of the temporal bone. Continue talking about the temporal bone. I would like you guys to focus on this inferior view of the skull. Here we have the styloid process of the temporal bone, and obviously we have the right and left ones. We have the mandibular fossa of the temporal bone, we have the mastoid process of the temporal bone. And we can identify these structures in this image on the right that is a zoomed in version. Now, here we have the styloid process. Medial to the styloid process, we have this canal. This canal is found in the temporal bone. And through this canal, the internal carotid artery passes. Consequently, this canal is named Carotid Canal of the temporal bone. Now, posterior to the carotid canal, we see this big hole. And this big hole is named Jugular Foramen. Now, pay attention that this is the occipital condyle of the occipital bone. And this is the occipital bone. You see? Posterior right here. Right? This big hole is the Foramen Magnum, remember? Of the occipital bone. So, you can conclude that the jugular foramen that we are seeing right here is made by the temporal and the occipital bones. And yes, the jugular foramen is a shared feature between the temporal bone and the occipital bone. Another cranial bone is the sphenoid bone. And the sphenoid bone is a very special cranial bone because it is the only cranial bone that touches all other cranial bones. If you look right here, this is the sphenoid bone. It touches the frontal bone, it touches the ethmoid bone, it touches the temporal bones, the parietal bones, and also the occipital bone. So it is the only cranial bone that touches all other cranial bones. And because of that, it is called the keystone, because it basically keeps it all together. Now, we have several bone features in the sphenoid bone, and you need to know them all. When we look at this anterior view of the skull, we can see that the sphenoid bone also is part of the bony orbit. And if we zoom in, we see an elongated hole, and an elongated hole is named fissure. This fissure is in the superior aspect of the bony orbit. Consequently, this is named superior orbital fissure of the sphenoid bone. Also, we have an elongated hole in the inferior aspect of the bony orbit. And this elongated hole is made by the sphenoid bone and also the maxilla bone. Since this is an elongated hole, it is a fissure. It is a fissure in the inferior aspect of the bony orbit. Consequently, this was named inferior orbital fissure, and the inferior orbital fissure is a shared feature between the sphenoid bone and the maxilla bone. Now, sometimes students get confused if they have the supraorbital or the superior orbital. And the way I tell students to remember is by remembering that a hole, a foramen, is short, and a fissure is an elongated hole. Consequently, for the fissure, you need to write the entire word, superior and inferior orbital fissure. And for the hole, you just write the short version, the supraorbital foramen and the infraorbital foramen. Now, looking back in the bony orbit, we see a canal. And through this canal, we have cranial nerve number 2, the optic nerve, passing. Consequently, this canal is named Optic Canal of the Sphenoid Bone. And when we look inside the skull from a superior view, we can see here the optic canal, the right and left optical canals. We can also see from a superior view other bone features that belong to the sphenoid bone. We see here the sella turcica of the sphenoid bone. And the sella turcica was named sella turcica because it resembled the horse saddle used by some Turkish people old days. Now, the sella turcica is very important because it houses the pituitary gland. So it's literally a little house, a little bony house for the pituitary gland, which is the major endocrine gland in our body. So we have the sella turcica of the sphenoid bone. We also have these 3 holes. And from anterior to posterior, these 3 holes are Ross. We have foramen rotundum, foramen ovale, and foramen spinosum. Obviously, the foramen ovale is the one that has an oval shape. And these holes serve as passageways for some of the branches of cranial nerve number 5, the trigeminal nerve. If we keep looking at this superior view of the skull, we can see the ethmoid bone. And the ethmoid bone is anterior to the sphenoid bone. And we can see the ethmoid bone right here better. The ethmoid bone has several bone features, including this little triangular structure that looks like a rooster's crest. And consequently, that was named crista galli, the crest of the rooster, okay? Now, the crista galli is very important because it basically anchors our brain anteriorly. It serves as a point of attachment for the dura mater, which is one of the 3 meninges that protect our brain. Now, if we look on either side of the crista galli, we see a plate that has several little holes in it. And this plate is called cribriform plate. And all these little holes serve as passageways for cranial nerve number 1, the olfactory nerve. When we look at the ethmoid bone from an anterior view, the only part we can see is inside of the bony orbit, right there. Which means that the ethmoid bone also makes up the bony orbit. Now, when we look in this picture, we see that the great majority of the ethmoid bone is hidden behind the frontal bone, the maxilla bone, and some other bones that we'll be talking soon. And that's why when we look at this image, we see the ethmoid bone a little faded. Now, when we look in this zoomed in image, we can identify the crista galli of the ethmoid bone, the cribriform plate of the ethmoid bone, and we see this thing that goes down inferiorly. And this is literally going down, dividing our nasal cavity. And this is called perpendicular plate of the ethmoid bone. The perpendicular plate of the ethmoid bone plus the vomer bone, which is one of the facial bones we'll be talking, form the nasal septum. And you can see them forming the nasal septum right here. So that's the importance of the perpendicular plate of the ethmoid bone. Now, besides the ethmoid bone being part of the upper portion of the nasal septum, the ethmoid bone makes up the upper nasal cavity walls. The ethmoid bone extends to the sides and forms the lateral walls of our nasal cavity. And extending from each lateral wall, we have the superior nasal concha and the middle nasal concha. And the superior and middle nasal concha, they serve as speed bumps that swirl, they move the air that we are inhaling within the nasal cavity. And that is very helpful to warm, humidify, and clean the air before it goes down our respiratory tract. So the superior nasal concha and the middle nasal concha are bone features of the ethmoid bone. Another thing we can see in this picture is these air spaces that we have within the ethmoid bone, and these are called ethmoid air cells, and these air spaces is what makes the ethmoid bone a very good example of a pneumatized bone.